Welcome to Mental Health Mini number 25, Premenstrual Dysphoric Disorder. Premenstrual dysphoric disorder is diagnosed through the DSM-5, which states that for a majority of cycles, the individual has to have 5 or more symptoms that must be present and improve within a few days after the onset of menses. These symptoms include mood lability, irritability and anger, depressed mood, hopelessness, and self-depreciation, and anxiety and increased tension. That is considered one category of symptoms, so they do have to have at least one symptom in that category, as well as one symptom in the next category, which would include poor concentration, decreased interest in activities, lethargy and fatigue, appetite changes such as cravings, especially with carbs and sweets, sleep changes, feeling overwhelmed or out of control, and physical symptoms such as breast tenderness and swelling, joint and muscle pain, bloating, and weight gain. So while they have to have at least one symptom in each of those categories, we would want them to have at least 5 symptoms total. Nursing considerations is that it occurs in about 6% of women, and experience of this disorder may fluctuate throughout the woman's lifetime and throughout their fertile years. Risk factor would include history of trauma, stress, genetics, having had no children or not using any contraceptive use. Nursing problems could include impaired functioning at work or school during that time leading up to their menses, impaired grieving, impaired coping, and social isolation. Treatment would be non-pharmacologically. We can make changes to their diet. This would include increasing proteins and carbohydrates, and decreasing salt, sugar, caffeine, and alcohol, especially if they're experiencing bloating. Decreasing that salt and alcohol will help with that. And if they're feeling irritable and having insomnia, reducing the sugar and caffeine can help with that. We can also encourage exercise, improved coping skills, and they can take vitamin supplements, especially vitamin B6, calcium, and magnesium. Magnesium is especially going to be effective in treating some of the anxiety that can occur. Pharmacologically, we can place them on oral contraceptives, a selective serotonin reuptake inhibitor, and if they're having inflammation and bloating, we can place them on an anti-inflammatory medication. We know that treatment has been effective if we see improved coping throughout the menstrual cycle, improved performance at work or school, improved satisfaction with socialization, decreased pain during their cycle, decreased bloating leading up to menses, and decreased inflammation. And that wraps up our psychiatric mini on premenstrual depressive disorder.